let's go get your picture taken.
Okay. Hello. You're gonna fill this out for me, and I want to just take your picture first. Come here.
Alright.
Let's get it. Fill this out for me.
Alright.
Okay. Ooh, organ donating.
Remember that thing that happened to Katie? Where a donor saved her life? I wanted to be an organ donor.
That's great, but you're only 17. I think you have to be 18 to do that.
Yeah.
We'll just wait until next year.
Okay.
Yep.
Personal ethics. Personal ethics describes an individual's own ethical foundations and practice. The sources of our ethics are not static and change over time, just as individuals grow and change over time.
Hi, Mom.
Hi,
What's her name?
Julia.
Okay, I'm just gonna do an assessment and see how she's doing.
Okay.
Maybe just go this side. Can you just move her? Thank you. Hi, Julia. My name is Maria. I'm gonna be your nurse today. Can you open your eyes? I'm just gonna listen to her lungs
Okay.
and heart, okay? Her blood pressure is going down. Her heart rate is also low. I'm gonna call the doctor to check her, okay? I'm just gonna check her pupils. Can you open your eyes? I don't see any activity so far. So, and you know she's on a bed. I may have to call the doctor to come.
Okay.
I'll be back.
Beneficence, an obligation to do good by acting in ways that promote the welfare and best interest of others. Beneficence can be accomplished by promoting good and preventing and removing harm.
Hi, this is Maria from the pediatric ICU. Can I speak to Dr. DeRoy? Thank you.
Hello?
Hi, Dr. DeRoy. This is Maria from the pediatric ICU. I have patient in room 43, Julia.
Yes?
She's a 17-year-old female. I'm calling because I just did my initial assessment. Her heart rate is 32, blood pressure is 70 over 40, GCS is 4. I don't see any pupillary reaction, and her voice is really weak. So if you please come and do an assessment on her.
Yeah, I'll be over there.
Thank you. Hi, we're back. So the doctor is here to check on her.
Okay.
Oh, you're Julia's mother,
Yes.
right? I'm just gonna do assessments.
Okay, go ahead.
Mrs. Jusega, as you may see, your daughter's on ventilator. The prognosis is very poor. As of now, we think that there's no brain activity. Can we talk for a little bit over here?
Sure.
So, your daughter is a good candidate for a donor. As a
You mean organ donations? But she's gonna be okay, right? She's not dying. She's gonna be fine. You're doing everything you can for her, right?
we are, but as you can see, the prognosis is very poor. I'm just giving you a heads up that you can donate and help other people.
I don't know. This is like really overwhelming. I mean, she did mention that she wants to be an organ donor, but I feel like you guys are not doing enough. I think you could be doing more for her.
I understand, but I would like to give you some time to think about this. I know it's very hard, and
I mean, I need my husband here, and I mean, this is
I
a
understand.
huge decision, and it's very difficult on the family. So I need to really think about it. Like, can she have an open casket funeral after this, after organ donation? I mean, I have so many questions. I don't know where to go.
If you decide to donate or proceed with this, there's a shared network that would come in and
Okay.
assess all
I
that.
really have to think about it, though. It's a huge decision.
Got it.
Was.
Hi, this is Maria, the nurse from pediatric ICU at St. Joseph's. I'm calling because I have a possible organ donor. She's a 17-year-old female, post MBA, and her heart rate right now is 38. It's very weak. Her GCS is 4. There is no pupil reaction. The doctor has already checked the patient. He says they're considering brain death. However, we're going to do more tests to confirm the diagnosis.
Well, we're more than happy to come and assist you and the family for this situation. This sounds like a possible candidate for organ donation. So, we'll be in shortly.
Mrs. Gisea, can I
Hi.
speak to you for a second?
Sure.
So we have done some tests, and I know you expressed some concerns that we're not doing everything that we can. Right now, there's no brain activity. She's in a coma. The vent is the only thing that's keeping her alive and breathing.
Brain death examination for infants and children needs to be performed by 2 physicians independently, separated by 2 different intervals. There are multiple tests of which need to be undergone in order to confirm brain death examination. Irreversible and identical causes of the coma, spinal cord reflexes, apnea tests, and ancillary testing is required. Both need to be able to sign off within the specific time frame. Justice. The principle of justice is concerned with treating people equally, fairly, and appropriately. We owe our patients care and treatment that does not arbitrarily discriminate against them and as an individual or as a member of a class of individuals.
I'm from the Sharing Network. It's nice to meet you. I'm so sorry to hear about your daughter.
Thank you.
So because we understand how frightening and hard and difficult this may be for you, we're here to provide support and understanding and answer any question that you have on this process.
Look, I know my daughter expressed to us that she wanted to be an organ donor, and we're here to learn about it more. And I know that my wife has some concerns, and she wants to ask you guys some questions. So I hope that you guys could clear this up.
I'm just not ready to let her go. I'm really scared about her, and I feel like if she's an organ donor, then she's gonna be disfigured, and it's a lot to take in. I can't let her go right now, and I feel like this whole thing is very difficult, and I want her to die naturally, and not have her organs harvested, and I just want this whole thing to be a natural process.
We absolutely understand your concerns. I just want to rest assured that both of you, the doctors have performed multiple tests to confirm that she is in fact brain dead, and the only thing keeping her alive right now is a ventilator. The nurse is going to talk to you now about the concerns that you have.
So, I understand your concerns, and I'm here to tell you that those are, like, whatever you're mentioning can be like some of the myths people have about organ donation. Um, your daughter will have a natural death. We'll get her off the ventilator, and she will die naturally, and then we'll take it to the OR to get her organs out of her, and we'll prepare everything. And the concern that you have about she being disfigured, she's not gonna look disfigured, and she will talk about that in a second. But yeah, everything will be like correlated for her to go naturally.
Okay. I mean, I'm still not ready for this. I feel like you could be doing much more to save her.
I understand that. The doctors have done and are doing everything they possibly can in order to proceed with that. I want to talk to you more about how you thought that she might look disfigured if we were to have possible tissue or organ donation.
Mm-hmm.
Organs and tissues, as you heard, donation is done in the OR. So this type of surgery is done similarly to that of other types of surgeries. Doctors will maintain dignity and respect for the donor at all times, so that the donation does not interfere with traditional funeral arrangements such as an open casket. So that would still be an option for you.
Okay, I mean, I feel a little better, but I feel like even though she expressed that she wants to be an organ donor, I just feel like she wants to keep fighting for her life. Like, she's too young for this.
We absolutely understand that, and we hear you, and your feelings are being acknowledged. Before we leave the room, I just want you to know that the organ and tissue donor, like Julia, can save 8 lives, and 72 people die waiting for organ transplant each day. I know that Julia would have loved to help people survive, as stated by your husband. With that being said, we will leave the two of you in this room and let you decide on in the future. If you have any questions, please feel free to ask me or Maria.
Thank you.
Thank you.
Hi, I just have some questions for you I want to discuss.
Okay.
My first question is, does Julia have any past medical history?
No.
No, okay. No problems, asthma, any of that?
No, she's healthy.
Healthy girl. Good. What do you think would be a possible success story for her if she were to keep, if she were to live? What would be a normal life? What are areas that you base that on?
Well, she always said that she wanted to go to nursing school. So I think, yeah.
And you would understand that because of her past, what had occurred in the accident, it's possible that she had physical, mental, and social deficits, correct? Are there any family issues that might influence the treatment decisions?
I mean, no, we're not particularly religious.
Okay. Is there any physicians or nurses that you feel as though in our hospital here might influence your treatment decision?
No, not really.
Okay. And you have been informed of the benefits and risks and understood the information given?
Yes.
Do you have any questions for me?
No, I.
One popular model for clinical decision-making is the 4-topic method of Johnson, Singler, and Winslade. The 4 topics are medical indications, patient preferences, quality of life, and contextual features. Within each topic, questions are posed that clarify factual aspects of the case, with an emphasis on the ethical principles of beneficence, non-maleficence, respect for autonomy, loyalty, and fairness. Answering the various questions provide a framework within which different options for action can be considered.
ventilator's only
They're
thing that's
not
keeping her
doing
alive.
enough. I feel like they're not doing enough. They stopped working on her and they just want us to like harvest her organs.
But
And I'm not ready
we
to
have
let
to
her
respect
go.
our daughter's wishes. You know she wanted to be just like Katie and help people like her.
But she's only 17. I feel like she can make it. I'm not ready to let her go.
I can't see her like this for the rest of my life.
Family. Our family is our first and initially most powerful influence on our ethical comfort zone. Many of our earliest memories are of lessons about right and wrong as taught by parents and other close relatives.
I wish my parents would just respect my wishes. When I was 16, my friend Katie survived because of an organ donor, and I would like to do the same with my own organs and help save a life.
Autonomy. Patients must be treated in a way that respects their autonomy and their ability to express their wishes and make informed choices about their treatment.
Oh god, it's just so much to deal with.
But you know what our daughter wants. She told us.
I'm scared that she's just gonna be disfigured, and if they take her organ, she's never gonna look the same.
We could talk about this over and over again with the nurse and the shared network with the organ people, but we need to make a decision now.
I think you're right. I think we have to respect her wishes.
I know this is hard for both of us, but I'll call the nurse and say that we're gonna do this.